In a rare moment today, the Republican Speaker of the House took to the floor to denounce a new federal rule on contraception. The Obama administration is requiring faith-based employers, such as hospitals and schools, to provide coverage for birth control in their health care plans. Many, including Catholic institutions, are opposed, and Nancy Cordes is at the Capitol tonight. Nancy, what happened?
Well, Scott, Congressional Republicans today vowed to fight this new rule, with House Speaker John Boehner saying if the president doesn't change it, he'll work to overturn it.
This attack by the federal government on religious freedom in our country must not stand and will not stand.
The new rule Republicans object to requires all employers who provide health insurance to their workers to cover basic birth control for women by next August. That includes Catholic charities, universities, and hospitals, which may object to contraceptives. Republican Senator Marco Rubio of Florida called the rule unconstitutional.
This is very straightforward. This is about whether the government of the United States should have the power to go in and tell a faith-based organization that they have to pay for something that they teach their members shouldn't be doing.
This is the 21st century.
Democrats rallied to President Obama's defense, saying the new rule, which is part of the president's health care law, is a matter of fairness for women, 99% of whom will use contraceptives at some point in their lifetime, according to the CDC. Senator Frank Lautenberg of New Jersey.
And it's time to tell those Republicans, mind your own business.
Democratic Representative Jan Schakowsky of Illinois pointed out the rule does not apply to the nation's 355,000 churches. Why is it the government's role to tell organizations what kind of coverage they should provide?
Because these are employers that operate in the public space, that do business in the public space, and that's the point of the Affordable Health Care Act, that all Americans will have access to the kind of health care that they need.
The White House said today it wants to work somehow with employers who are uncomfortable with this new rule, and pointed out, Scott, that this is already the law of the land in 28 states, where those states have managed to work out concerns with organizations.
Thank you, Nancy.